This meeting is being
Live stream.
Yes, start, ma'am.
streamed.
Atanu, now you can just welcome the doctor,
Very good.
introduce
Okay,
to all the
okay,
participants, and then we can start.
okay, ma'am. Okay. So, a very good evening to all the eminent doctors. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila through its innovation to serve the society and humankind. The topic of the webinar is dosage reduction strategy in rabies management, role of novel vaccine. Dear doctor, rabies is the world's first novel 3-dose anti-rabies vaccine. With great pride, we would like to inform you that rabies has successfully completed 1 year of launch with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded and no case of adverse effect was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. Sumit Poddar, President of APCRI. And now I would like to request Dr. Poddar to initiate the talk, and later on we will have a question and answer session. All the participants can drop their question in the drop box and we will read out all the questions after the presentation. So, sir, please start.
Okay.
Over to
So
you,
kind
sir.
of you, it's a wonderful program because we started with 14 dose nerve tissue vaccine for the prevention of rabies, and then followed by the simple vaccine and other things were there also. And ultimately, we have come down to reduce the doses, and it is now we can complete the dose by only 3 doses of vaccination in the prevention of rabies. That is dosage reduction strategy in rabies management, because the role of novel vaccine is there. Number one thing, we have already we are already accustomed with what is rabies, animal bite incidents in India. Just in a short way, I just telling you, rabies is definitely it's a viral disease, and viral encephalitis is the outcome is 100% fatal outcome is there. So prevention is better than cure. That is the main thing. So we'll have to prevent it that the patient does not develop with rabies. The basic management that should know, that is our wound toilet for 15 minutes of time. It is very important. The objective is with the soap and water, it washes the virus in the site of entry at least 50%. Now the next other things that we'll have to give the vaccine and rabies immunoglobulin for the management of itself. Now, animal bite incidence in India is very high. Still now, we already, these are all known to us that 20,000 annual death rate was there in the year of 2003 and 4. And globally, it was 59,000. Now, due to the adoption of introduction of the vaccines, modern cell culture and tissue culture vaccines, the death rate has definitely has come down. The figure of 59,000 globally, and in India is 20,000. It is far previous figures. But recently we have gone for another study with ICMR and everybody with NCDC. And we have seen that, of course, with the help of APCRI, we have seen that the rabies death has come down. Naturally, we still believe that is 10 to 12,000 annual rabies death is found throughout the India. So rabies is 100% fatal, but the main important part is the 100% vaccine preventable disease. That means if you do the wound toilet properly, give the vaccine, give the immunoglobulin, particularly in case of category 3 exposure. So in that case, the patient will be free from developing rabies. So evolution of rabies vaccine is another important thing. What I was mentioning just in the year of 1885, a boy was with the a animal, and ultimately he already given the vaccine, first vaccine in the world developed by Louis Pasteur, and that is in the year of 1885. And that patient, that saves the life of the patient. So after that, we have gone through different type of vaccine, different dose schedule and everything. But ultimately, it is definitely in the two important things. The basically, number one thing is wound toilet and give the vaccine. Now, next, this important thing comes in our mind that whenever we are introducing this treatment, we must see that wound toilet should be 100% accurate because it reduces the chance of rabies by 50%. Then there are three categorization. One is category 1, category 2, and category 3. So in case of category 1, you all know that usually these does not require any proper treatment except other than wound toilet. That is in case of category 1. Then category 2, without any bleeding, scratch, and everything is there, that should be treated as category 2. Category 2 treatment is very simple, that we'll have to give the vaccine and wound toilet is a must. And third thing is the category 3. That is the dangerous thing, and that category 3 is also very important to give the vaccine, and proper in case of bleeding wound should be given with the rabies immunoglobulin. So these are the main things. This is the basic concept of the treatment, that we'll have to give the rabies immunoglobulin because the incubation period of rabies is very valuable. Then we'll have to give, after administering rabies immunoglobulin, the virus will be neutralized. Then we'll have to give the vaccine also to get the high level protection. And so current challenges are there because what I have mentioned, current rabies vaccine are cell culture vaccine, that is the CCV. So it is not an hard tissue vaccine. In the year of 2006, we have practically say goodbye to the nerve tissue vaccine because there are many reactions are there, and there may be possibility of development of neuroparalytical complications. So we had to think about this part, and the patient has to be given with the cell culture vaccine perfectly okay. Then is these vaccines, the cell culture vaccine, they are near about more than 50 years of old technology. So there are many problems maybe questioned, and problems may arise. Inconsistency in potency, number one. The stability is another thing. And that is whether it is stable or not. And number third is a short supply, because India is a country where there are many patients are getting the vaccines, but the production is also less. So we'll have to think that starting from the low, starting from the nerve tissue vaccine of 14 days, then it has come down to 6 doses of tissue culture vaccine, that is also there. And so after 6 doses of tissue culture vaccines, again, we have come to reduce the dose of the vaccine. That is exactly needed. So what happens, when this vaccine works, then if it is 100% okay, then the antibody will arise in the day 14, protective level of antibody. So these vaccines are very important. And so vaccination is practically preventable aspect. We are looking to it. So this is the must thing in case of any dog bite or any warm-blooded animal bite. We'll have to, three things has to be done properly. One is our wound toilet for 15 minutes under the running tap water with soap and water. At least 50% of the virus can be washed out. Second is our in case of category 2, and then in case of category 2, we are already given the vaccines of 5 to 6 doses. It has come down to, at present moment, at least 4 to 5 doses in essential. And after that, we are thinking towards to minimize further vaccine. With the dose of the vaccine, for the betterment of the patient, so that on a very short period of time, he will get the proper antibody production, and also he'll be able to free from any possibilities for developing rabies. So this is the main thing, because the challenges are much more, because 4 injections we have tried and 6 injections also we have tried. These 4 injections we have seen that we have to give day 0, day 3, day 7, and day 28. And previously we are using 5 to 6 doses of vaccine. So now just dose reduction is needed. Somebody is failing to get that dose properly to be injected in the particular time, but he may miss the dose. There may be dropout. So another important thing is we'll have to produce such a vaccine which can give the protection within this time. So it is very important. So it is a novel vaccine, and introducing the novel vaccine is with simple and shorter regime is very important. So this is the vaccine, is Travis. So Travis is prepared in the VLP technology. And so it is very important that with this VLP technology, the vaccines are being produced, and they have already introduced the Travis, and this Travis is definitely a very good thing. It is a fast vaccine with 3-dose schedule, and it is, of course, the intramuscular regime, and that to be given only in intramuscular regime. It is not to be given in the intradermal regime. So, prepared by the BLP platform, this technology is there, and fast protein subunit vaccine. This is the world fast protein subunit vaccine. And another thing is our better compliance due to the easy to follow the regime and less visits. That is, every people is busy. So we'll have to think that is already 3 doses has come. After that, if we can think for reducing further dose, the time will say that even this can be given in another shorter dose, that is the 2 doses vaccine. That will be in future consideration by us, that the patient will have to give the release the antigen very slowly, and it will definitely in the body for more than many times, at least the time is covering the incubation period of these vaccines. So of this disease, better compliance is there, less visits are there, and convenience, ready to use, and it is a must more thing that it is very ready to use. You can use it ready, no mixing, nothing else, no reconstitution is needed. So this is the VLP technology. And now the VLP technology, the native virus is there. G protein is difficult to stabilize, G protein isolation using VLP technology. VLP means a virus-like protein. So purified and stabilized by the early thing is the Cadila Pharmaceutical. It is the world first company who has come with this strategy and with these proper vaccines. Next is VLP are the protein complexes exist as the nanoparticles. That is important. VLP are similar to native virus particles, but that do not contain the viral genome. It is also very important, and they cannot replicate, but they cannot mimic the viral antigenicity without being pathogenic. And the next is they are capable of introducing a strong humoral and cellular immune response. That is the ideal thing. That is inducing the strong humoral and cellular immune response. That is the important. And VLP as vaccines can be used very safely. And so, what is practically VLP technology? That is to be seen, and just a slight highlight. It was our original research article published in our journal, ATCRI journal, that is the Association of Prevention and Control of Rabies. That they are the organization, and we have already established that one. That we have given the case studies and report by Michelle, Ashok Agarwal, Amit Soni, and Sima Sharma. Already it is published in our indexed journal. It is indexed in Index Copernicus, and also it is trying to get that A with the PubMed indexing. So study design, there were many studies are there. There are many data are there. Day 14 antibody, day 42 antibody, day 90 antibody, day 180 antibody, and day 270 antibody. That different type of dates has been chosen to see the potency, and the phase 2 data, it was there, novel for the novel rabies vaccines. And study design was there, and comparing with purified chick embryo cell vaccines and other vaccines, that the 2 dose and 3 dose, there are many things are there, and there is a big study. And clinical safety or clinical study in phase 3. That is another one. It has been published in the Human Vaccines, Immunotherapeutics. That is a human vaccine, it is published. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. A randomized, comparator, controlled, multi-center phase 3 clinical study was done. So it is mainly from the Bangalore, and the study was done, and it was already, that has been published in the Human Vaccines and Immunological. So this is the main part, that clinical study has proven that the efficacy of the vaccine, actually 3 dose versus 5 dose, there was a comparison also there. Actually, what happened after administering each and every vaccine, 3 dose has been, after getting the antibody titer after 3 dose is coming protective on day 14. Then after that, the other doses which we are administering is working as a booster dose. So it should be kept in the mind that after 3 doses, the patient already reaches its antibody, that is more than 5 IU per ml of blood. That is definitely in the day 14. And after that, it persists for a longer period and longer time, and the patient are getting protected with these 3 doses of vaccine. The other dose, which 2 doses we are administering in a schedule, that works as straightway. That is the main part. That is the straightway it is acting to the titer above for more than 5 IU, 0.5 IU. So it is very important, the phase 3 study, to evaluate immunogenicity and safety of rabies G protein vaccine. Many studies were there. So 32037, these days regime has been seen, and it was trialed and given on 533 subjects. And Rabipur, there were also studies. It was, that means it is a purified cell culture vaccine. It is also a good quality vaccine, but the dose is much more, more doses are required. But in case of rabies, that has been novel G protein vaccine, that is the dose schedule is only 3 doses. Now, there were studies, the primary objective is subjects with seroprotection at 14 days. Post first dose seroprotection RVNA titer more than 0.5 IU per ml of blood. Secondary objective is subjects with seroprotection at day 42 post first dose of test vaccine. Safety by monitoring the subjects with adverse events. Seroprotection is there, the protection obtained by vaccination. It is also published in 2021 November, and it is also been highlighted in the human vaccine in that way, it is highlighted. Next is our
Have we lost sir on the screen? Hello? Yes, sir, your connection had gone in. For
Hello?
your connection is
it's all
gone. It's just come back.
right.
Yes.
Am
Now we
I
can hear
audible?
you. Now we can hear you, sir.
Yes, sir.
Hello, madam.
Yes, sir.
Hello.
Yes, sir. Yes,
Is
sir.
okay?
Yes, sir, we
Yes,
can hear
yes,
you.
sir.
now.
You
We
can
can hear you.
Thank you. Thank you. So one thing, already there were results, efficacy, safety, everything has been written here. That is number one, safety, definitely. The non-inferiority and seroprotection is day 14 and 42 were met, and also test the comparator are identical in seroprotection rate both on days 14 and days 42. The days 14 is usually all the vaccines give the protection, but it is also remarkable that on day 42 it is also important, because rabies is such a thing that it is having a very highly variable incubation period. It has been seen that it is on the day 14 also, definitely it is very positive in producing the antibody levels. I have seen a patient who has developed rabies in the year of 2009. The name of the patient was Shubhajit Mondol from here, Rajarhat area. He came to me. And that patient has a history of dog bite on 6th July in Rajarhat area. and after that he succumbed within 2 days of time. So we have seen that many variable incubation period is there. So rabies is such a disease that should not be given any chance second times to treat. Whatever we'll have to treat, we'll have to treat on the first day. That is when the patient comes to us. Then the basic thing is wound toilet, then your vaccination, and if it is category 3 exposure, we'll have to give the immunoglobulin. The most important part is another one, that is our most important thing is that when we are giving the 3-dose vaccine, it is getting the immune status more than 0.5 IU per ml of blood. So after that, the patient definitely receives as per the schedule, he receives definitely with the our cell culture vaccine as well as with the rabies immunoglobulin in case of category 3 exposures. So these are very important things, and these less adverse we'll have to think today is in such a world that everybody should get a minimum number dose, number one. Second thing is a full 100% protection. So in this way, the Travis has proved very efficaciable in preventing rabies encephalitis. So basic treatment is wound toilet, first of all, 15 minutes under running tap water. Second, if it is category 2, only vaccine. If it is category 3, that means any bleeding wound comes under category 3, we will have to give the rabies immunoglobulin. There are many rabies immunoglobulin in the market. Monoclonal antibodies are there, and human rabies immunoglobulin are there, and equine rabies immunoglobulin are there. But with this one, I can say that this vaccine is effective within 7 days of time. So we'll have to give this Travis, the 0, 3, and 7, 3 doses enough to protect the patient from developing rabies. So it is very important, and there is a very less adverse effect compared to reference vaccine. And also, novel 3-dose Travis was found to be safe and immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccine. So this is the main point, that we are administering 3 doses, getting the protection, full coverage with the antibody titer, and definitely the patient is safe and immune to he will not develop rabies. So this is the thing. And another important thing with this noble work, there is a great thing from Cadila Pharmaceutical. They have received the awards because it is the first time. First time they have come with this vaccine, that is within 3 doses, and definitely within a very few days, we'll definitely also will be able to reduce such dose. If the vaccine they can modify certain other things, then definitely this one we completed. Now 2 dose, then it will come to 2 dose, then it will come to only single dose. So for those dates, that time we are waiting. So Travis is definitely a wonderful vaccine, and it is being well accepted by many of us, because the time consuming, time is a factor, and the patient will get a very good reaction. So this is very important one. And in case of re-exposure, the patient has received the vaccine, and then again he is bitten by an animal, so the warm-blooded animal, then the dose will be day 0 and day 3. That is in case of re-exposure. So it is very important to note these points. The first 3-dose vaccine, then in case of re-exposure, 2 dose, then on the future dose of vaccine, then we'll have to give 2 doses of vaccine. So this is the main thing. And we have seen that by using service, there is at present moment, there is no case of failure being noted. So it is also very important because we know in case of dog bite, if the patient is not being treated properly, there may be a chance of failure to the treatment. So we have got another paper also regarding the failure of vaccination. So that can be discussed in other way, in other days also. But this vaccine is a very crucial vaccine. This vaccine is a very time consuming, where minimum dose of vaccine by producing the proper antibody level by the day 14, definitely. But we'll have to give the up to 0, 3, and 7. Only 3 doses is required. And apart from that, it is definitely to be kept in the mind that the patient should get only at least wound toilet properly with soap and water. That is the main thing. And another is the proper dose of vaccine to be given, and the vaccine to be given not in the gluteal region. All the vaccines should be given in the upper arm, because in the gluteal region, due to the deposition of fat in that area, there will be less absorption. So less time also needed. So it is better to give it is a must that the patient should be given the vaccine in the upper arm. And it should be kept in the mind that today we can think that definitely there are other problems, and their medical legal importance and medical legal consumer protection act is there. So the vaccine, all the vaccines have to be given in the upper deltoid or anterolateral aspect of the thigh. So this is the main thing. The children dose is same, no problem. The children dose, still there are some studies going on, but they have already told that this can be given in the mainly in adult. And very few days, I think there are studies that continuing for administering the vaccine in the children to the children, and I'm confident about the outcome of the day. And so by this one, I can conclude my speech, and with a kind request to you all, kindly ask me some questions so that in case of in general on rabies, not properly on the vaccine, vaccine part is now over. The in case of the rabies, how what are the other things? Will you kindly tell me so that I'll be able to discuss with you all, share my knowledge with all of you. So thank you very much.
Thank you so much,
Madam.
sir. Thank you so much, sir. It was a wonderful learning for me also, learning everything about the way the evolution of rabies has happened such a long time. And you have been a party to the changes which has happened. As on now, the live feed, we have more than 75 doctors listening to you now. And there are quite a few questions which are there. I'll just start to ask you. There is a question which has come in from Dr. S. Chatterjee, where he has asked, is there any category 4?
No, actually, once I was telling that category 1, category 2, and category 3. But we can think about category 4 because just a single bite, transdermal bite with just a single drop of blood comes under category 3. Okay, there you will have to give the vaccine as well as rabies immunoglobulin. Also, we have noticed very huge bite. I can show you the photographs. There is a huge bite, and that patient is also there, the category 3. So category 3 can be considered as another one, that category 3 and 4, there should be some severe bite. Severe bite should come in the picture. So the treatment for the severe bite and the other bites is all the same as per WHO and NCDC guideline. But in case of huge bite, there is a huge area has been involved. There you have to give the our vaccines. So vaccines as well as immunization with the infiltration with the our rabies immunoglobulin. So this is very important part. But one thing I have seen that in case of severe bite, the amount of our rabies immunoglobulin is something is less than the exact surface area of the bite. So it is very important. You will have to take the decision whether you will dilute the A, and you will have to, in those cases, what we'll have to do, we usually do, use the insulin syringe because because we'll have to give the vaccine immunoglobulin locally. That amount is definitely should be accurate. So by using the insulin syringe, we can save much more dose of vaccine, and we can give the immunoglobulin quite rationally and to the all wounds. That is important because in one wound, if I skip, then maybe that part is full of rabies virus. So there will be chance of failure because it is very important to see what is the surface area and how we are infiltrating, technique of infiltrating. There should be another workshop, particularly on technique of infiltration, and that is two important part. And the vaccines and the should be, dose is accurate and it should be given as per the WHO and NCDC guideline.
Okay. Thank you, sir. So there is actually two questions which has been asked by Dr. Tapas Kumar Ghosh. In his first question, he has asked, have you assessed with antibody assessment? And then again, he's asked, is it assessed by serum antibody assessment?
Now, what is the question of Taposh?
Is it assessed with antibody assessment?
Antibody assessment, we have to do it. But one thing, two places are there at present moment, apart from NCDC and apart from NIMANS. And there are main, also in the Delhi, there are centers. And also very recently, ID Hospital, Veliaghata is now also imposing this kind of antibody calculation. Antibody, what is the protective level of antibody, whether he has achieved or not. So it is very important. And NIMANS is a pioneer in this aspect, where they are regularly doing it. And Taposh is working in, so far I know, if it is that Taposh goes, he has worked with in a setup in like ID hospital. So he is very knowledgeable person. I know it. And also he has also been treating many cases of animal bite. But there are many flaws are there also. There are some portion. Basically, what we'll have to do, we'll have to go for a single agenda. That is wound toilet. If it is category 2, only vaccine. And if it is category 3, we'll have to give the vaccine plus immunoglobulin. So another important thing, we cannot give a stitch in the wound. And because there will be chance of more of the viral contamination will be there. So it is better not to give any stitch. If we'll have to give stitch, then it should be properly infiltrated with the rabies immunoglobulin. Then only one and two loose stitches can be given. So this is the important thing. And the antibody response has to be done properly because the role of antibody response is very, very methodical, and that gives a proper idea whether the patient is protective or not. So it is very important to see the antibody level, whether it is protective or not protective. If the patient is not protective, then additional vaccination will be required. Mind it, that additional vaccination has to be given at least 2 doses of vaccination. Another important basic thing is not to give the vaccine in the gluteal region. Due to the deposition of excessive fat, the gluteal region should be skipped. So it should not be given. You can give it in the anterolateral thigh, we can give it in the in the upper arm. And in these vaccines are liquid vaccine. These vaccines are not to be recommended for the intradermal use. So intradermal use, there are only few vaccines are there that can be with the modern tissue culture vaccine or other method that can be given the proper dose of vaccination with the intradermal regime. And another important thing, because it is a burning problem that the many patients are either going to hospital, they will get the proper treatment, no doubt about it. Another is some patients are going to outside the hospital to the local private practitioner. So they should have a clear-cut knowledge how to give the vaccine, what is the method of infiltrating the wound toilet with the rabies immunoglobulin, and all these things has to be kept in the mind. So I am very confident that all the doctors, they are coming out in such a way that they are well capable and they are very knowledgeable. All the doctors, most of the doctors, how much vaccine should be given, what is the dose of the vaccine, how to give the rabies immunoglobulin to be infiltrated in the wound. So these are very valid questions. And so rabies will not definitely give the second chance to treat. We know it. So to avoid this one, the minimum dose of vaccination is definitely play a crucial role, an important role for the eradication or control of rabies in our India. And so these are the main things. Thank you, Shagurika. I can see you in the thank you very much for the wonderful,
Thank you, sir. Thank
what
you.
I will say, wonderful discussion. And we have seen the many.
And sir, also, sir, I would like to
also.
convey special thanks. I'll convey special.
Yeah, definitely. You are great. You are doing a lot of things in
Thank
this
you,
way.
sir.
Thank you.
Thanks, sir,
Thank
for
you.
your priceless contribution. It's a
Thank you,
priceless
sir.
contribution, sir. And we'll
Thank you.
always remember your lucid presentation, sir. Thanks, sir.
Thank you. Thank you. Thank you.
Thank you so much,
Thank
sir,
you very
from the Cadila head office for having shared your information with us. And most importantly, your experience with us, because it is an experience which makes the talk much more interesting than everything else. So thank you so much. We are eternally grateful to you. And we look forward to having some more such discussions with you as well, sir. Thank you, sir. Have a great day.
Thank you.
Thank you.
Thank you. Thank you.
Thank you, sir. Thank you, sir.
বন্ধ হয়ে গেল নাকি? বসে আছে এটা হলো বলা গেলে খুব ভালো লাগছে স্যার। আপনি তো এই যে আপনি যেটুকু বলেন তো সব পুরো একদম এক্সপিরিয়েন্সের আপনার তো এই আপনি একটা বই এইরকম করি আপনি ধারাবাহিকভাবে বলে যেতে পারেন, কারণ আপনার এক্সপিরিয়েন্স আপনি জীবনে এটা আপনি পুরোটাই এই করা এর ছবিটা দেখিয়ে দিতে পারতাম বইয়ের এটা বন্ধ